There we go. I'm sorry, I'm not so good with those things. Okay, so my topic today is on the UN ECE protocol on water and health, which is quite a unique, legally binding protocol. But before talking about that, I would like to remind us that for the topic of water and gender, this year, 2020, is quite unique because we now celebrate 75 years United Nations, and we all know that the United Nations has gender equality front and center in its charter. We haven't achieved it yet, but at least there is this strive since 75 years to create these equal opportunities and rights for men and women. On top of that, we commemorate the 25th anniversary of the Beijing Platform for Action, which was a landmark in addressing equitable and sustainable development, including gender perspectives and women's rights, because it addresses the women's issues across the board of all the sustainable development issues. And it was it was adopted by 189 member states present in Beijing 25 years ago. It caused a wave. So this year we evaluate this important platform, and I would like to quickly refer to that as well, because water was not, I'd say that in the next slide. The last one is the 10th anniversary of the human rights to water and sanitation, which has taken quite a while, but the United Nations has acknowledged water and sanitation basic services as a human right 10 years ago now. Now, going back to this Beijing Platform for Action, it had 12 critical areas of concern, and women and health was one of them. Water was not considered as a critical area of concern at that time, but it is somehow included in a few areas, rather marginally. In the case of women and health, it states that lack of food and inequitable distribution of food for girls and women in the household, inadequate access to safe water and sanitation facilities, etc., overall burden women and families and have a negative effect on their health. So it is included, but it is a little bit hidden. With respect to the Women's Agency, this is addressed in Area K. And it says I'm not saying this one. I'm also stating the Action 106, where it says what needs to be done in order to ensure those basic services not only for women, but in particular including women. So it is an action for governments in collaboration with non-governmental organizations and employers, workers' organizations, and with the support of international institutions to ensure the availability of and universal access to safe drinking water and sanitation, and put in place effective public distribution systems as soon as possible. That was the way it was approached 25 years ago. And you will see that contrary to these days, women are not seen as, women's civil society is not really seen as an important agent in this field. When we link it to the current 2030 Agenda for Sustainable Development, we address the interface of three important sustainable development goals. Of course, the gender equality goal, but then the relation to the water goal and to the health goal, which is number 3. In case of the SDG 6, the water goal, there is 3 specific targets that relate to today's topic. Target 6.1 is achieve universal and equitable access to safe and affordable drinking water for all. So that's the drinking water part. The target 6.2 addresses the sanitation goal, universal access to sanitation and to stop and open defecation. And then there's the third one, which is relevant. It goes about the improvement of water quality, reducing pollution, and also including the untreated wastewater, which partly is on sanitation again. The health goal is less specific on these contents, but if you look at the targets, the relevant one is 3.9, because there again it is reducing death and illness from hazardous chemicals in air, water, and soil pollution and contamination. So this is the current context. But I would like to focus on the Protocol of Water and Health, which is a protocol to the Convention on the Protection and Use of Transboundary Watercourses and International Lakes. And it is for the UNECE, Economic Commission of Europe region. And this region includes, it's pan-European, and it also includes Central Asian countries, I think, except for Afghanistan. This protocol was adopted already in 1999 by these member states of the UNECE region, and it entered into force in 2005. Today, 26 countries have ratified the protocol. Now, what does this protocol strive for? Its main objective is to protection of human health and well-being through good water management. So it explicitly links the health to good drinking water and adequate sanitation and prevention of pollution. So it strives for two things. On the one hand, the equitable access, both in terms of water quantity and quality. And on the other hand, also the protection of the water sources, the water environment, and the conservation of the resources. So it's an integrated approach to make sure that we have sufficient, safe, and healthy water. And how is this achieved? Well, I've stated a few overarching principles, which is that it works within the integrated water resources management framework. I will get back to that later on. And that, amongst others, says that action should be taken at the lowest appropriate level. So not everything can be done by the national government. It has to be decentralized if that is appropriate. It practices already a rights-based approach, and it stresses the importance of public participation, which in fact is also an element of a rights-based approach, that you have the right to information and the right to participate. And then for those countries that ratify and that underscore this protocol, it sets concrete targets and target dates. And I think one of the later speakers, Ms. Emma Anakazian, who has been actively involved in her country in this, can speak more relevant to this latest point. With respect to practicing a rights-based approach, I want to remind us that the human rights to water and sanitation is now 10 years ago. So that was in the year 2010, while the protocol on water and health was already approved 10 years or 11 years before. So it was a little bit ahead of its time, but nevertheless, this protocol for the current right to water and sanitation, it provides a real good framework to make this happen. So in this pan-European region, after the protocol was approved and adopted, what has happened between those years and 2017? Because everybody thinks, if you think of Europe or even pan-Europe, that water and sanitation is taken for granted. But that is not entirely the case. Between 2000 and 2017, more than 63 million people gained access to drinking water services in the pan-European region, and 85 million people gained access to sanitation services. But nevertheless, to date, or in 2017, it was yet 16 million people lacked basic water services. And 31 million people do not have access to basic sanitation. So there is still this gap, even in the pan-European region. If we look on where this gap predominantly lies, the joint monitoring program of World Health Organization and UNICEF, it says that 72% of those who lack basic water services and 95% of people using surface water as their water source, they live in rural areas. And there is a specificity for the Caucasus and Central Asia. 12.5% of the population is still without at least basic drinking water, mostly in the rural areas again. So you see that it is a urban-rural disparity, not surprisingly, which brings me to the implementation challenge that this protocol still has, where it is stressed that public participation is very important. Yet the data suggest that the majority of countries, procedures exist, yes, but the level of participation is still low. And the participatory approach is really essential if you want to work in decentralized settings. Those of you doing that will know, and will also know how difficult it is to go from principles to practice. It's a long and painstaking process, which we see across the board. What do you need? It is also, again, it's not new, this knowledge. Already in 2000, the World Bank evaluation of its rural water supply project talked about the social capital that you need in order to make this participatory approach work. The challenges for making decentralized rural water supply services work sustainably and reach all intended beneficiaries are typically of a social and institutional nature, and a social nature. And they noticed that villages with higher social capital have much better results than villages where the level of social organization is low. Also, the greater social capital in a community leads to more participation in service design, to more effective rules for governing implementation, and to better monitoring of construction use and maintenance. So we all know where the challenge lies, but it is very hard to implement. I always like to give definitions. There's a lot of definitions about social capital, but in this case, I like to use the one from Dekker and Uslaner, which says that social capital is about the value of social networks, bonding similar people and bridging between diverse people with norms of reciprocity. This gets me to the women and water connection. Women's civil society represents high social capital and is therefore a very valid tool for achieving these targets of universal access to drinking water, sanitation, and also to reducing pollution, especially in those decentralized settings that still are lacking this access and that cannot be served by those central water supply systems, and where the social capital, as we have seen in the previous World Bank evaluation, is so important. So, one of the reasons why when in 2000 the World Water Forum in The Hague, we started the Women for Water Partnership was especially this, that this is a much underused tool, let's put it that way, to help us achieve universal access and clean water and sanitation for all. I also said that this water and health protocol works within the integrated water resources management framework. I quickly want to get back onto that because this is, sorry. I want to get back to that because this is also one of the targets of the water goal, and it overarches everything. If we look at water in an integrated approach, that's when we achieve the results that we want. So a brief definition of integrated water resources management is that it is a process promoting the coordinated development and management of water, land, and related resources in order to maximize the resultant economic and social welfare in an equitable manner without compromising the sustainability of vital ecosystems. So it has a social, economic, and environmental component. And we always have to look on the balance between those three. Why am I referring to this? Because this IWRM was based on 4 principles. Principle 2 was about this participatory approach that I talked to you about earlier, which is so crucial if you want to create universal access to water and sanitation. And the third one specifically refers to the central role in the provision, management, and safeguarding of water. And these Dublin Principles were already approved in 1992. So the basis is there. The same focus was in the previous water decade, the Water for Life decade, 2005-2015, also had a specific focus on IWRM, and with the full involvement of all relevant stakeholders, including women. It had a specific focus on women. But nevertheless, if you look at this baseline study for integrated water resources management, and I've already said that also in one of my previous presentations, we see that this is the targets and the indicators that are lagging behind. Gender objective scores are low across the board globally, not only in the UNECE region. And quite a few countries still consider gender not applicable when it comes to water management. And this is something which all of us should bear in mind and maybe do something about it, as long as this is not turned around while we are more than 25 years after Beijing and even more after adopting the Rio Dublin Principles. Still, at the country level, the governments say if it comes to water management, gender is not relevant. So my argument is that this third Rio Dublin Principle is also highly relevant for the women, water and health context. Women play a central role in the provision, management and safeguarding of water. And we don't have to reinvent the wheel. Already in 1992, it was said that the grounds was laid in what is needed in order to make this happen. The pivotal role of women as providers, users of water and guardians of the living environment has seldom been reflected in institutional arrangements for the development and management of water resources. And acceptance and implementation of this principle requires positive policies to address women's specific needs and to equip and empower women to participate at all levels in water resources programs, including in decision-making, and then it says in ways defined by them. So active participation of women, as far as I'm concerned, is not maybe the solution, but it is an important tool to take into consideration to accelerate the implementation of the water goal, and therewith the acceleration of all the SDGs that we are striving for. I think that the Water and Health Protocol is a very positive and I say that early on strive to make this happen. So I commend the ones who have done all this, and I hope that in the following presentations I hear more about what this has led to. I wish you all a very nice and successful conference, and thank you for your attention.